Good morning, everybody. We're going to give it another minute. We're going to kick off about 10:01, just to allow as many of you to log on and be available for our webinar. So please bear with us. We will aim to kick off in about 30 seconds or so. Thank you. Welcome everyone to this morning's Morgan Hunt webinar, Unlocking Diversity for Success in Social Care. This is aimed at adult social care organisations and those working within them. And we're going to explore how social care organisations can use the diversity of their workforce as a potential competitive advantage. My name is Claire Canary, and I'm a director at Morgan Hunt, and I also lead on diversity and inclusion. For those of you who don't know us, Morgan Hunt are a UK-wide recruitment business. We have offices in London, Birmingham, Manchester, and Glasgow. We were established over 30 years ago, and we specialise in further education, public sector, charity, not-for-profit, and of course, recruitment into social care. I'm really delighted this morning to be joined by two experts in their field. Firstly, I'd like to introduce David Kester. David leads and advises on complex projects and pioneers ways to turn social challenges into innovation and enterprise for various companies and organisations across the UK. He was previously CEO of the UK Design Council and is currently MD of DK&A. We're also joined this morning by Amarjit Basi, and Amarjit has been working with David to support multiple organisations turn the hyperdiversity of their workforce into an asset for social and economic good via the London Equity and Design Partnership. Amarjit is an executive and founder member of the Black Leadership Group, which was established in late 2020 to tackle systemic racism in further education. And throughout his career, he has held senior leadership roles in various further and higher education institutions. So welcome both of you. Before we kick off our session this morning, I'd like to ask a favour from our audience. I'd like to ask you to put into the chat on YouTube just 2 to 3 words that would describe your key motivators for joining our session today. I'm not going to call on anyone to talk, but it's just to get a sense of what your drivers and motivations are for the session. And while we're waiting for that, just a few pointers on the format of this morning. We'll have a brief presentation from David, providing an overview of the work the Design Lab have been doing across London and with lots of different sectors and the positive impact this is starting to have. We'll then have a discussion around that and explore how this support and help could be put to good use within adult social care organisations. I'll aim to have about 5 to 10 minutes at the end to answer any questions you may have. So please, at any stage of our conversation this morning, please post any questions in the YouTube chat. We will see them and we'll endeavour to answer as many as possible. So to kick off, David, if I could pass over to you, you're going to lead us in your presentation this morning to talk us through your experiences.
I am indeed, and I'm going to do that with Amarjit. We're going to try and do it. We haven't rehearsed this, but we're going to try and do this together. As we work together, we're very much partnership. We've put this together and I'm sure it'll be what it'll be. If I can find my presentation, here we are. Sorry, slightly messy desktop there being revealed.
No problem. That's great. We can see it now, David.
I'm just going, if I may, I'm just going to minimize the pictures on my screen just so that I'm able to see all the slides better. There we are. Right. Amarjit, maybe you want to introduce us.
Yeah, no problem at all. I think, first of all, Claire, thank you so much for the invitation and the opportunity for us to talk about workforce integration and specifically the opportunities afforded from the learning that David and I have effectively embarked upon over the last 2 years and its applicability to social care. We're really, really excited about doing that.
And I mean, what we want to talk about, well, I mean, it's really a bit of a provocation because I think you've given us 10, 15 minutes, Claire. So we're going to try to cram in as much as we can. But I think the thing that we're most interested in is point 5. It's actually questions and it's the conversation that we're going to have. But what we'd like to do is we've got a little bit of a kickoff. And in the moment, I'm going to run a little exercise, if I may. But we'll say a little word or two about us as well and our motivations in this space. We've got a couple of questions that we thought we might put forward. I mean, how do we view equality, diversity, and inclusion today, and what's the future for EDI? We've got one story, and we've called that the Sacred Heart. And then we'll talk about our approach to what we call equity-centered design. We'll explain what that means, and also 1 or 2 tools and tips. And then really the things that we're interested in, because it's a wonderful opportunity, this. And so we're very, very grateful for this forum, Claire, and we're really keen to have the conversation together. So that's our agenda. We hope that that's a good agenda. But before we do dive into that bit about us, if I may, I've got a little question. And I mean, everyone's had a bit of a practice here, putting some questions in the chat. I want to ask you to do this in a slightly different way now, because I want to ask you a question. How might we enable everybody on this call to get their voice heard, particularly when we get to that discussion? So that's the question I'm asking you, but I don't want you to, please don't put it in the chat yet. What I want you to do is I just want you to think about the answer to that question. How might we enable everyone on this call to get their voice heard? Okay, and I want you to think about that and think about what creative ways might we come up with right now. But as I said, don't write it in the chat yet. Now I'm just going to give you another 5 seconds that you've got 1 or 2 ideas there in your head. Now what I want you to do, before even pushing send, I want you to type it into the chat. Okay, but don't push send. And then what I'm going to do is I'm going to count to 3 and then everyone's going to push send at the same time. Okay, so what I'd like you to do is type in your idea. I'm not watching the chat at the moment, by the way, so I'm hoping that, Claire, you're going to be able to tell me what's happened. But I'm going to count to 3.
Yeah, I will.
When I count to 3, everyone's going to send their ideas. So 1, 2, 3. Okay, let's send.
Great. And while we're doing that, David, just so you know, it does take there's a little bit of a time lag. So I just wanted to also let you know some of the points that people have put in on the back of my initial questions. So we've had improving inclusivity. These are motivators, strategies for equity, and more understanding of promoting and championing diversity in social care. And then learning more about ED&I. We haven't had anything through yet in terms of that piece around how do we enable everyone on this call to get their voice heard, but it might be just a bit of a time lag there.
Okay, well, I mean, essentially the reason that I did this, and it's a little design technique that we would use in a workshop. We call it silent and solo, which is that we ask people for their views and their ideas, and we ask them to firstly hold them in their mind, then write them down, and then share them, and do that anonymously. And then we can begin to collect those ideas, see the connections between those ideas, and then we get a real sense of what's going on. And we call that process both silent and solo. And it's very important because it's a way of democratically sourcing thinking and ideas. It's just one little technique. But I really wanted to just introduce that because I suppose in a way it gets across something about the sort of tenor, the sort of approach that we, both Amarjit and I, have been following over the last couple of years, which is finding new ways to get people to collaborate and to democratize thinking so that everybody gets their voice heard in a good way and in a positive way. And that's been really, really important. And it's really important in the way that you do design and innovation. It's particularly important when you've got people who feel underrepresented in the conversation. We'll come back to that. But Claire, if there isn't anything that's actually, if I haven't managed to motivate people, has anything actually appeared on that?
No, it hasn't yet, but it
okay. Well, maybe it will. But we'll move on. And we'll say a word or two about who we are and who we work with.
Thank you. And Claire, you did a really nice sort of bio overview about me, so I'm not going to repeat that. What I will say is that, as Claire alluded to, my career has really encompassed education, and that's been my passion for moving into the equity and organisational change space, because I really fundamentally believe in learning organisations, which has everyone on board. I have a particular affinity to social care because my partner is a managing director of an adult care company in Cornwall. And it's been really, really insightful to hear and learn about not only some of the stresses of adult social care, but also some of the opportunities. So really, really keen to unravel that during the course of the next hour or so.
And I mean, thank you again, Claire. Yes, you give a great introduction. And yes, I spent 30 years in my career working in design and innovation, but particularly on social change and how you can apply design to drive societal change and environmental and social change. And I did that when I ran the UK Design Council, and also now running a sort of joined up organisation, which is very much teach do. So consulting and running projects, as well as running a small school called the Design Thinkers Academy. And this sort of topic has always it's motivated me for lots of reasons, partly because it's about social change, and I've done a lot in healthcare, but also, I suppose, really like everyone, I've been affected by the issues that we're going to be talking about. So many of us have, and I recently lost both my parents, and that end of that last 5 years of life was all about social care and actually managing to navigate that difficult space. And it's been something that I've always wanted to do more work in. So, I mean, this today is a great opportunity to have a conversation about something I care passionately about. But together, we formed London Equity and Design. We call it LEAD. It's a partnership between our two organisations. Is very much about bringing our disciplines of equity and diversity and inclusion, of anti-racism and design practice, the collaborative design practices and the practices of anti-racism together, very much an interdisciplinary approach where we bring these methods and approaches together to create a new discipline. And we'll be talking about equity-centred design. And we've worked now over the last couple of years with a lot of different organizations, with engineering businesses, including Arup and others. We've been working with the Welsh Government, particularly the BLG, but we've also been doing work there together on that. And as a partnership, we've been running the Mayor of London's Design Lab, and you can see on the right some of the businesses that we've been working with in great depth, running immersions and supporting the development of ideas and seeing those ideas into reality, and all around how we drive inclusive practice and how we tackle anti-racism. I don't know whether you want to elaborate any more on that, Amarjit.
I think the insights that have been enabled by working with government, working with the Mayor of London and the GLA's team, as well as sector-orientated organisations. And as David said, also a deep dive privilege of working individually with the organisations has beautifully given rise to the couple of questions that David's pitched. So in order to keep the conversation going, I'm just going to fuse into this, and it'd be really, really great to get some reaction to the first sort of observation that we'd like to share with you is, how do we view EDI today? And we did a little bit of sort of prep on this. We sort of consulted artificial intelligence because these are my words, sort of immersing myself into equity and design, because I'm not an expert in this field. And actually, in many cases, fresh perspectives has been a real key enabler. I would describe this space as embattled, contentious, pretty performative, piecemeal, and short-term, not sustained. And it's arguable in the context of the progress and the impact things have made since the onset of the Equality Act of 2010. And when we entered this into a generator, these are the images that surfaced for us. The notion of EDI professionals having tin hats, and also that actually people have conversations, but they go round and round and nothing ever changes. Would love your views and your response and reaction to that.
And we asked a second question of ourselves, and really, again, love to hear your thoughts, which is, okay, well, maybe you'll agree or you'll disagree, but this seems to be the experience that we've had and the frustrations that we've seen of teams working in this space. But when you actually talk about and you get people to think about the future, they start expressing different words. And Amarjit's really put these down here, but they are words that I think are very powerful about what one might want to see, something that's more unifying, collaborative, transformative, integrated, sustainable within organizations, and really having an impact. And I mean, this has come from a lot of frustration of how slow change is happening. Well, anyway, we entered these into the AI image generator. It just seems appropriate, doesn't it, now that AI is there to see, well, a picture tells 1,000 words. And we get very different sorts of pictures and images here of people sort of being lifted up together, of people sort of showing their superpowers. And we thought, this is quite exciting, quite fun. But maybe there's a different way to express what that future looks like, because AI is artificial, after all. So maybe this is a better image. Amarjit, maybe you want to explain what this is.
So This is the graduation of the NHS trust that worked with us, supported and enabled by the Greater London Authority. And this was effectively the culmination of working with 11 of the largest NHS trusts in London, who recognise that they have a big problem, Euston, and they needed to work and engage and approach equity, diversity, anti-racism in a totally different way. And there was huge learning that arose from Design Lab, which we're now going to effectively share with the social care cohort participants.
Yeah, so we see that, I mean, you can see here, I mean, of course, you know, the fun picture, but really, I think what we really wanted to get across was this process which individual organizations have been going through with their teams, and the collaborations across these different organizations has been very uplifting. And it's actually moved forward. It's created that sense of vision and purpose, momentum, and driven the projects and the interventions in sustainable ways. And we're seeing those come through. We're looking forward, actually, because we're now working with the Chartered Institute of Personnel Development, CIPD, on this, in sharing those as case stories, as well as we're now beginning to award and reward some of those stories as well with the GLA. But we thought we'd tell one story, and this particular story is it is a real story, but we've fictionalized it because we really want to be able to have an honest conversation. So this is based on one real trust that we've been working with. We're not going to go into every bit of detail, but we just thought it might be helpful to talk a little bit about one story. So we've called it The Sacred Heart, which was from a television series called Scrubs. So it is a fictional hospital based on reality. And Amarjit, do you want to tell us a little bit about maybe, you know, what they saw as their problem and what they introduced us to?
Yeah, and I hope this now starts to build some substance for participants, colleagues, and so on. So the symptoms that were the heart of the problem were the metrics, the race equality standard indicators weren't great. The survey that undertaken in this organisation on an annual basis identified some alarming trends around access to CPD, harassment, bullying, the whole notion of psychological safety, and the notion of progression. Complaints, including cases that ended up as grievances and ultimately tribunals, were in many cases undiminishing. And there were responses which identified good intent on the part of the organizations. They tended to be EDI-led. There was a lot of training, the notion of hearing different voices through Speak Up fora, and also legitimizing, supporting employee networks, and finally listening exercises. And a lot of this was sponsored with good intent from leadership and board, but it didn't lead to any tangible progress. Indeed, actually, some of the metrics for this organization have gone backwards. And as a result of that, we really drew upon a model that's inspired from Harvard. It was a Harvard endorsed article, which has been forwarded by Professor Ella Washington, which identifies 5 stages of organizational EDI maturity. And you can see the pyramid, you know, the notion that organizations awake to the need and the possibilities of EDI, and then they move into compliance, and then tactical, and then greater levels of maturity are enabled when EDI is a part of everything that we do. And in many cases, utopia is when it's naturally occurring, it's best of class, and so on. And on the right-hand side, we mapped where Sacred Heart have been in the context of their engagement with us, and including preceding us as part of the work that we've been doing with them. And I think it's fair to say it's been a journey. And at 2019, they were generally at the first level of maturity, where there were a genuine desire, good intent, but in many cases futile sort of opportunities to shape the culture and secure tangible impacts. As a result of interventions, including some of the work that we've been doing with them, their own self-evaluation is they've moved from an into compliant and the bottom end of tactical, which is moving beyond the rules, becoming more sort of holistic in the approach, and customizing EDI initiatives. But as you can see, there's further progress that they have to secure.
And I think it's really, I mean, it's early days, isn't it, Amarjit? So we can't say for sure what the ultimate outcomes are, but what there is now is a tremendous optimism, a sense of vision, and a much more joined up thinking between leadership and the networks, the team across the board. Something is starting there, that sense of placing the ultimate purpose of the trust, the idea of the trust in terms of what it's trying to achieve in terms of health outcomes, in terms of achieving equity in health, and how that ultimate goal is affected by the internal way in which representation, teams are engaged and integrated. And now there's that sort of greater realization that these things are integrally woven together. The more integrated the team, the more representative the team, the better the outcomes, the more representative of the patients and the wider community, and ultimately the better health outcomes, the more innovative the organization. And that's really beginning to generate different sorts of ideas and thinking. Indeed, some of those got awarded by the GLA at their symposium in last September.
And totally. And there've been 5 particular principles that underpin that growth. And we've called this equity-centered design. And this is effectively the heart of the reason for that fundamental mind shift. Yeah. That's Sacred Heart. And David, if you want to go through those 5 principles, I can sort of augment as we go along.
I will. And I think it's important to say that these are not principles that we've invented, and we very much adopted. The practice of bringing design and anti-racism together really originated in the States. There's been some really good academic work around it, both in terms of academic centers such as Stanford, and also some really good publications by, for instance, the Bill and Melinda Gates Foundation. So we've been very much adopting those principles and putting them into practice. But this will give you a sense of really how we've been doing that, and that sense of what those principles look like and what they might mean in practice. So designing at the margins has been really important. So building for the marginalized communities which are most hurt by oppression and bringing them into the design process. So that's been really critical at each stage of what we've been doing. We've often organized things like immersions. You can't involve everybody, but you can get, for instance, what we often call the diagonal slice of the whole organization and bring that together so you get real representation and use techniques that mean that those people can have a voice. Starting with self, so recognizing that personal mental models, including our biases and assumptions, impact solution design, those are there on both a conscious and unconscious level. So we all bring our biases into the every single session, and we have to actually recognize that, start with an understanding of what we're bringing in, and have the mechanisms to ensure. So, for instance, we'll often organize things like an amnesty for ideas and thinking, so that you can get some of those biases out. Ceding power has been important. So actually genuinely providing the power to underrepresented individuals who are then brought into the design process, and making it safe for them to speak truth to injustices. And that's actually very, very difficult. And I have to say, it doesn't get easy as you go through this process, because naturally there are people who will be in positions of power who have to hear things that are painful. And for instance, when we've been going through this process with Sacred Heart, we've been uncovering stories and allowing those stories to be told. And they are often painful. We've had some moments where actually even the head of EDI in the Sacred Heart has welled up as she's been hearing some of the stories, which, you know, she thought, well, surely those are not the stories that are going on a day-to-day basis. And of course, they are. And making the invisible visible. So really explicitly calling out those practices that have historically advantaged dominant groups over marginalized groups, and actually sort of making that and putting that out there, making it visible within the sessions that we run. Those have been really important, but also then ultimately speaking to the future. So defining innovation within the organization then as an increase in equity and a reduction in racism. So these are the sort of filters. I mean, we're using design practices, we're using anti-racism practices, but everything is filtered through these principles. So whatever we're doing, we're saying, are we designing at the margins? Are we really starting with ourselves? Are we ceding power? Are we making those invisible issues visible? Are we genuinely speaking to the future and developing something new here and calling out the new as innovation for our organizations? So, I mean, I wonder, because we're sort of rounding the corner and I realize we're limited in time, maybe we could share a few tools and tips before we maybe also pass back some of the questions we're interested in. Over to you, maybe Amarjit, to start off with.
Yeah, so the first one is fundamentally working with organizations so we can really crystallize the challenge and challenges they face. And what we do here is effectively create some how might we statements. It's an approach where, you know, identifying the crux of the issue, but articulating in a word that talks to everyone.
And then also really deepening our understanding. So to get to a really well-framed problem, we need to have done some really good engagement, and people need to have uncovered the issues beyond what you might see on a survey. So often, for instance, we've been engaging in ethnography, which is essentially a fancy way of saying anthropology, or having lots of good conversations in a method with good method behind them, and aggregating that thinking so you can really build the themes and depth of understanding. We sometimes talk about not a bird's eye view, which you might get from a survey, but a worm's eye view. So really seeing things in depth and in detail.
Yeah. And above everything, this has to be a collaborative process. So David's also already alluded to, you know, the democracy of ideas and free thinking. And what we've done is developed a number of ways that we get democracy, and especially in the equity space, where some of those voices are not heard, and psychological safety can be a key disabler.
And sometimes those workshops have been in person, haven't they, Amarjit, and very intimate, and sometimes they've been online, and the online workshops have been really, really powerful as well. And that often you have to then take into account people's technological ability. Is this actually if you go online and you have a conversation online, is that going to disadvantage certain groups? And in that case, maybe you can't do it in that way.
Mm.
As well as, I mean, I think this has been very, very powerful, BLG's own SALT framework, because you brought into the process. And for me, it's been one of the very powerful things in what we've done together, Amarjit, has been that we've brought these design processes together with the sort of tried and tested anti-racism framework, such as the SALT framework that you've developed through the BLG.
Yeah. And interestingly, you will have seen the AI generated image where you've got super powered characters there. So we talk about the SALT framework as the anti-racist superpowers, and everyone can acquire, develop, and practice those.
And I think the other bit has been about really experimenting and trying things out. And that's really at the heart of innovation. In gaining the insights about the unmet needs in the organization that are going to actually drive progress, picking, prioritizing the things that everyone sees they could afford and may have the most impact, and then actually running experiments, trying things out. And I mean, that's what actually we're doing at the moment, because we're 2 years into running a lot of these projects. And what we're seeing is real live projects running. They are experiments, often now affecting thousands and thousands, tens of thousands of people, but they're early days, but we're seeing wonderful things happen. But we learn then as we go. And that's actually very important, is sticking one's neck out, but actually doing it in a good way. So build it a little bit, one step at a time, test it, learn, feedback.
Yeah. And experimentation can feel a bit of a misnomer in the EDI space, because people are often very mindful of making mistakes and using the wrong language and others. And actually what we say is that progress in this space, it's necessary to learn from your mistakes, and experimentation and innovation is a key part of that.
Yes, one has to be careful of that. Everything has to be perfect first time. It's never going to be.
Yeah. And finally, we do ensure that on the EDI space, that the burden is not placed to particular specific groups. It's important that everyone takes responsibility, and we particularly I advise that key constituents are in the rooms, decision makers, resource holders, and stakeholders, including people with lived experience. And if you get that healthy mix, anything is possible.
All right, great. So we did have some, I mean, these are some of the tips. You've got a sort of sense, maybe. I mean, obviously, we can't go through all of the methods here, and very happily, Claire, we're keen to answer questions. I'm sure you've got some, but we've got questions, I suppose, really at the top of our mind, because we are interested in what's the appetite for change in social care, and where you as leaders in social care see the challenges here around anti-racism and social equity, and what success could look like for you. And I think that one of the reasons, and I think we should declare our hand here, is one of the reasons why we're so interested in is that we've tried, and we haven't actually managed to get some things off the ground in social care. And it's been a frustration, if I'm honest. So we did reach out. We had fantastic conversations with Skills for Care and other organizations. And we opened the opportunity to for social care organisations to participate in the design lab. And we did get some sign-ups, but not enough. And the sense that we got was people are overburdened, the system was just too stretched, and that they couldn't even think about sort of attempting the sorts of things that we were doing with these other businesses. And we were we were frustrated, disappointed as much as anything, because we thought, well, actually, the thing is, addressing these issues addresses the wider issues of innovation and change within the sector. The more diverse we are in the social care sector, the more the sector represents its constituencies, the more diversity is at all levels, including in management and leadership, the more innovative it is. And if there are tensions within the sector, which we've seen, for instance, in healthcare as well, where there's a lot of recruitment internationally, and there isn't that sort of sense of workforce integration, that then slows the system and makes it less effective. So our instinct was, surely we should be working in this area, and that there should be really great work happening. And the sense was there was some appetite, but it wasn't happening. So we weren't sure why that would be, but we were really keen to see and really keen to have a conversation, because we think it's really important and we're very motivated in this area. I think that's it, really. Amarjit, unless I've missed something.
No, I think that sets up, what would be great to hear people's perspectives. But I know also, Claire, that you've probably got some questions that you want to explore as well.
I have some questions while David's unsharing there, but just also a bit of an answer, David, to the kind of challenge you threw down. I mean, I think somebody was saying utilising a chat function, but also allowing a space for anonymous feedback and anonymous conversations so that people feel comfortable. And I think that talks to what you mentioned around the democratization of the conversations. Just a quick question that wasn't on my list, but I wanted to just check because, well, it kind of ties into one of my first questions. I mean, social care is very much, we use the term Cinderella service. I think only one politician mentioned it in the most recent election campaign, and that was on the back of his own personal experiences. That politician isn't going to be in the government, but, and it's been the service that actually, particularly adult social care, that actually politicians they know there's a big issue and they've kind of stayed away from it. And it then adds to the whole pressure. It's an under stress service, the budgetary, the time, the workforce pressures. There's a lot of conflicting priorities. So I'm going to ask why they should consider embracing equity as a core priority. But before I do that, budgetary wise, which is a big issue for these organizations, what you've talked through sounds like an amazing program. What kind of budget challenge, what kind of budget would they need to put to something like this? How could they access this training without it impinging massively, I guess, on their own budgets?
Yeah.
Amarjit, or do you want? We can both answer. Go on, you first, and we'll see what we come up with.
Yeah. So my response to that is particularly for a sector under stress, embattled. This is not simply something that's bolt-on or additional. Consider that, and it's not just a moral and a social case. It's also a business case, and it's really important that this agenda is integrated. People can see the direct link with care outcomes, about the level of belonging, the importance of developing the business in a much more ethnically diverse world. Look at the level of contribution that communities can make as well as people in the workplace. and actually see it as fundamental to the core business, central to the core business.
Thank you, Amarjit. Sorry, David, did you want to add to that?
I just want to come in there that, I mean, I suppose there's a couple of points. One, I don't feel that I mean, yes, we do, both of our organizations in different ways run trainings, but what we've not been doing here is training. We've really been enabling organizations to have the conversations and make the changes themselves. So it's been very much facilitating with some good methods and processes. And in that sense, actually, to answer your point about money, I think you can do it with as little money as you've got, because that's the most important thing. You don't need to, okay, if you're not feeling confident about something, maybe you're going to go and reach out for a bit of help from someone. But a lot of this is stuff that organizations can just get on with, and they can pick off some of the best practices. They can, in the context of, for instance, if they're London based, the GLA is actually organising fantastic opportunities to bring companies together and have conversations and share practices. The important thing is actually to do this and not run lots and lots of trainings. And often, I think one of the things that we found is that some organisations spent a huge amount of money sheep dipping people on trainings and having very little impact.
To show for it, yeah.
Yeah. And what we've really been trying to do is support organisations on a much more transformational cultural journey, where the integration happens, where teams begin to work better together and have greater impact. And of course, that's ultimately, have productivity, effectiveness, impact. That's what we're all about. So I think it's actually seeing that connection. And I think that's the light bulb that sometimes goes off with the organizations that we've been working with, which is, hang on a moment, we're really talking about better health outcomes here.
Yes. So on that, because that's something you've mentioned, both of you already, I was interested in exploring, those outcomes. What are the benefits? How does equity-centered, design improve the service delivery and the end user outcomes? Could it, in your opinion, David?
Yeah. Well, essentially, what you're doing is you're bringing together a team that better often understand its end users and also understand its internal users. So what are the unmet needs? Where are we going wrong? The customer experience and the employee experience. And I'm somebody, we do this for a living for all sorts of different sectors, whether we're working in retail or whether we're working in manufacturing. And ultimately, these two things are totally interwoven. The internal experience of employees and the external experience of customers. And we all see it ourselves when we go into a restaurant. If the team isn't a motivated, happy team, then it completely changes the experience for the customer. When a team really understands and they're really integrated, and also they understand their customers and they relate to their customers, things move well. And that's actually, we know, don't we, that businesses and organizations are driven by culture. And these better cultures that represent, actually in this country, Britain, which is becoming a more hyper-diverse nation, which, will be, by 2060, will be over 30% in terms of the mark of sort of diversity across the nation. So if we really want to represent that, you have to integrate that in the business, and that's what drives the outcome. Sorry, Amarjit, I can see you coming in.
No, that's okay. I'm just going to give three sort of tangible examples of that, Claire, which, beyond the Sacred Heart example, I know these organisations will be happy for me to share this. So, for example, one of the challenges in the context of core business that the NHS blood and transplant organisation trust covers is actually they get too few underrepresented communities donating their blood. So they identified that as an equity crisis, equity challenge. in the fact that, as you will know, over 50–60% of London's population are from Black and minority ethnic. How do we tap into that? It's an equity crisis, and that's something that they're really, really working and galvanizing on core business. Another example is National Trust, the National Theatre, where over the last 10–15 years, you can see the tangible content on the stage has diversified. But if you and I visit the theatre and the South Bank, the audiences still are not diverse. That's an issue and a challenge of diversity for them. And the third one, interestingly, we've been working with one of the biggest gaming companies, which is equity has always been seen as a sterile subject in the gaming industry. But for example, the coders, again, in that industry are not diverse. And therefore, what they've looked at is that actually we're missing an opportunity. Our biggest forte is gaming. And how can we gamify equity so that it's an exciting, sort of core discipline asset that we can build on? So we've been working with those companies on totally refreshing something that has a umbilical cord to the core business.
Yeah, and it kind of goes back to that model, going from the awareness through to sustainability. And unless it's in every thread of what you're doing and how you approach everything you do, you won't bring everybody with you, but it won't be embedded and it won't be sustainable, and people won't feel the benefits. So that really makes complete sense. Amarjit, could I ask you around recruitment? Because, you look at the news, adult social care has a challenge with recruitment, probably similar to the NHS as well. And we talked about the fact that actually there's a lot of overseas recruitment that goes on, and that goes on within the social care sector as well. But in a recent survey, 2020 in the UK, 67%, almost 70% of job seekers said that they would consider workplace diversity and equity a factor when considering employment opportunities. So it's becoming more and more important, and they're really keen to see it less as a performative measure and something that is truly embedded and sustainable. So in what way does might that commitment to equity and diversity help attract top talent within social care, in your opinion?
Yeah, I think part of it is breaking some myths. One is that there's a lack of supply in the context of that talent pool. So, one statistic I just wanted to put to you because it's close to my heart is that by 2030, 75% of undergraduates in London are going to be from Black and ethnic minority backgrounds. So there's no supply issue. The second thing is aspiration. People want to develop and nurture their careers, and there's a good pool of talent at the baseline of organizations, but they tend to be in the operational roles, and it's an increasingly no-go area, including in social care, when you get to middle management and senior leadership and governance. And the final thing is that the sheer change in the demography of the UK, within 2.5 decades, over a quarter of the whole of the UK population are going to be from Black and minority ethnic. It's a business case. More of your clients will need to be diverse. And I think there is an issue about diversity, the cultural challenge of the clients in social care homes not necessarily being as diverse as the demographic trends. So I think there's an important, compulsion that people need to be able to see what they want to be. And
yes.
Talent development is a key part of that.
Yeah, thank you, Amarjit. And David, I think you might have mentioned this already in the presentation, but there's lots of studies around the fact that inclusive companies or companies that focus on equity and make it a sustainable piece, you know, they're almost 1.7 times more likely to be innovation leaders. So they think differently. So you know, it is aligned to recruitment, because it's great getting people in, but then you need to retain them. And to Amarjit's point, you need to retain them, and then you need to develop them ideally into leadership roles as well, rather than they just stay here and, you know, and don't progress up through the organization. So in your opinion, what impact does this inclusivity, this equity focus have on employee retention and overall satisfaction?
I mean, I think I'm not 100% sure how to answer that, because I'm not sure that I've got the experience from the projects that we've run.
Yeah.
Are the fact that we're seeing from the insights of the teams that have been working on this, we're now seeing genuine projects which are actually attracting that young talent, and also projects that are advancing talent. So actually, if we took the example of the Sacred Heart, as it were, which is a real trust, they actually have now co-developed a program to accelerate talent through the business. It's up and running, and it's moving talent up through the business.
That's true. Yeah.
And I think the interesting thing there is that we were talking about that relationship between diversity and innovation, and it's not just the diversity in terms of background, ethnicity, and or other areas of diversity. It's also just a diversity of thought, and that diversity of thinking and of ideas also generates innovative thinking. And I mean, just to give another, you know, another reference, a practical reference, in one example, I think it was actually Imperial College. We found that there wasn't a strong enough relationship between this sort of accountability for appointments and appointment panels. And the teams were actually really focusing on that and trying to think, well, how can we strengthen that in an imaginative way? And they came up with their idea. Their chief executive is called, his first name's Tim. So they came up with the idea of the Dear Tim letter. And now, after every panel, a Dear Tim letter is written, where the panel writes what happened, and they send that to the chief executive, and the chief executive reads it and writes back. So there's an absolute direct connection going on. The CEO who said, I want to see this really happening, is actually getting the letters and responding to the letters, and the conversation's happening. And it's been made very personal and very creative. And so I think it's actually, you know, you get the diversity of thinking on the topic, and you get better connections across the business, and but you get, you know, really creative ideas, and you get the impact, which is what.
Yeah, I'd just like to chip in, and you're a recruitment company yourself, Claire, which is that representation matters, but there is also a bigger prize, which is very much David's point about harnessing the diversity of thought and the background and so on. How many recruitment processes, for example, frame the question, which is, how do we need to change in order to accommodate and harness and maximize, optimize your talent and your potential? Everything's geared towards a JD and a person spec, which is about obedience, about fitting in, supporting the status quo. Where does disruption come in?
Yeah. Yes. And, you know, the most innovative recruiters and employers who get the best talent, their focus is on it. They see it as that two-way process, and they know that they're on show, and they have to demonstrate that. But that's too few still. And that real change is a really important provocation. It needs to happen. Well, I'm afraid we're pretty much out of time. So thank you both. I did want to finish just on one thing. We are going to circulate the recording, and there will be contact details for both David and Amarjit if anyone wants to reach out to them independently and find out more about their work. So I'm presuming, in terms of how they would do that, they can just do that with both of you. Yeah. Like I say, within the next 24 hours, we'll circulate a recording. I'd like to thank everyone who attended today, and thank you for your time. But a massive thank you to my two great guests, David and Amarjit, for their time and expertise and for making this such an interesting session. So thank you both, and have a fantastic day, everybody.
Thank you, Claire.